Keeping patients out of the hospital, that's becoming more and more critical across the Tampa Bay area, of course, to keep that curve flattened. That's how the COCO clinic came to be. COCO stands for COVID confirmed, and the clinic operates virtually. Now, the problem is staffers are overloaded, and 10 Tampa Bay reporter Liz Crawford found out the patients are sicker.
We stopped taking referrals from the Department of Health because we couldn't handle the volume in the clinic.
Less than 2 months ago, the COCO clinic was accepting patients from all over. The telehealth clinic, made up of med students and other medical trainees, offered 24/7 care via phone or video chat. Some patients, like Patricia Diaz, wore monitoring devices. This is what she told us back in May.
Sometimes they could call me 3 or 4 times a night to tell me my oxygen levels at the beginning. It was kind of scary at the beginning because they were calling me quite a bit during the evening in the middle of the night.
They nursed her back to health, and Diaz was grateful for the care, something she might not have gotten now. In the last 2 weeks, the COCO clinic has had to limit their acceptance to only very sick patients.
They require ICU care or ventilation. And later on, they have been discharged and we have them back in the clinic.
Have you had any patients that have come through the COCO clinic pass away?
We have, unfortunately, most of these patients we have promptly identified that they need a higher level of care. So they have passed away in the hospital.
Dr. Perez Colon and about 150 staffers have seen 3,000 coronavirus patients.
The community transmission is pretty high in the whole Soto County right now. The 3 most common places that we hear that they have gotten the virus from have been bars or restaurants, family gatherings, and then definitely churches.